good. We're fancy. All this
We're
technology.
all this technology, we are getting in the groove of it, my friends. Welcome to Talk with a Doc with one of our favorite humans on the planet, Dr. Joe Cribbins. Hello, friend.
Hello, how was your day?
It's
And
good.
hey,
It's
everybody.
even, yeah. And it's even better now that we get to have this conversation together. So, very excited about that. So before we get into it, I'm going to wait to make sure that we can be seen on all the other platforms and all the other places because I know it sometimes takes a minute. But one of the reasons that we're having this conversation live here in Riverside is well for a couple of reasons. We get to not only own the content, but we get to share it with our followers, with our members, and you with your patients. So we really appreciate switching gears and trying out this new tech with us.
Yeah,
I know you're always down for almost anything. You're like, if it
sure.
helps patients, if
I'm
it's
like,
good
sure,
for the
we'll try it.
community,
We'll just go ahead and try it. If it
right?
helps, we'll try it. I may get it wrong once or twice, sometimes 3 times, but if
Sometimes,
it
sometimes three times. Oh my goodness! All right, my friends, I'm going to make sure that I have the chat pulled up here, and I can see some people are checking in. Awesome, you guys. Welcome, welcome. Okay, well, before we get into the questions, Dr. Joe, I'm very excited to see you because we are traveling to you on August 5th. My husband is
Yeah,
having bariatric surgery, and you are his surgeon.
very exciting. I am so
Very.
exciting for him. Like, I really am. Like, I
I
really
know.
am. With what
I
he
know.
does for a living, it's just so physical. He's just gonna feel so good, so much quality while he's working.
Yeah.
I'm super excited for him.
Yeah, and I know what made him really comfortable with making the decision to have surgery with you is you really asked him about not only like our life together, but you asked him about his professional life. So he's a high steel iron worker. He's lifting
Yeah.
a lot of things, right? So he needs to be healthy. And in that discussion, in the pre-op discussion you have with him, you really went into depth with that, and you helped him understand why the sleeve was really going to be the best option for him.
Mhm.
Yeah, amazing. So we are very excited to be visiting you soon, and beyond excited for my husband to treat the disease of obesity in this way.
Exactly. Yay.
Exactly. Yay. All right. Well, we got a little bit of a warm up in. I think we just dive into the questions,
Let's do
and
it.
we got six. They are amazing questions that came in from our community members, and I think from a few people on your end as well. But before we get there, will you introduce yourself for anybody who doesn't know you yet?
So I'm Dr. Joe Cribbins, or often known as Dr. Joe, bariatric surgeon, 26, 27 years experience
Hmm.
in the North Dallas area, although I have patients from really all over the country
Yeah.
pretty routinely. 100% robotic bariatric surgeon, and I think there's a lot of upside there in that.
Yeah.
And I'm also Marty's dad. If anyone knows Marty the office corgi, he lives with me. So
The favorite video so far that is my top all time on anything on social media is you making that Netflix style documentary talking about how you
oh,
work for a dog. Oh my god.
even I thought it turned out well, and do you know why it turned out well? Because it's true. It's
Because it's true.
because it's true. Don't get me started. It's not uncommon. I'm going to round like post up, and I walk in the door, and they go, "Where's Marty?" And I'm like, "Oh, well, like actually, Marty rounds separately from me often after because it would
Right?
take a very long time."
It would take a very long time. It would take a very long
So
time.
he's a separate. Don't worry, he's coming, but he's a separate visiting. It is, yeah, it's easy because it was so true.
It's easy because it was so true. You said something earlier that maybe I'll make that kind of our first little question, but we really want to start asking this. So you've been practicing bariatric surgery for a very long time, and like you said, you're 100% robotic. So I think for people who are new to this space, there are really kind of two ways that surgery can happen. It can happen robotically, or it can happen laparoscopically. Both are extremely safe and effective. No issues there, whatever, but you have opted to become a robotic surgeon. What are those benefits that you feel are brought to your patients in your practice because of that tech?
Yeah. So I really like the Da Vinci platform for, I mean, a bunch of different reasons. I mean, from a patient standpoint, I feel that the recovery is quite a bit quicker. Um,
Mm.
With traditional laparoscopy, which is also through those very small incisions, the instruments can put quite a bit of torque on those muscles, and that torque can cause some muscle damage, and that's going to hurt postoperatively, and it's going to sort of prolong the recovery.
Okay.
The robotic system, it's smart. It knows where it is in space. It kind of does more of this rather than that. So there's just much less trauma to the muscles, and so the recovery is quicker. As far as recovery goes, the preciseness of the surgery also helps. You're going to have less blood loss, which helps postoperatively. And the safety of the procedure with the way that the tools work with their the risks that they can do. Traditional instruments kind of do this. The robotic
Hmm.
instruments can, do all of that you need them to do. So there's less tugging, there's less pulling, you're going around corners. You're doing, a difficult backhand stitch in this corner over here a lot more precisely than you would maybe with laparoscopy. There's just a lot of upside to it. The vision is super excellent. It has three different cameras. Laparoscopic vision in general has one, so you're kind of looking through the toilet roll, one dimensional. The robot has three, so you're kind of looking this way. You have depth of field, which is very nice when you're operating.
Yeah.
You have a special camera that you can use different dyes to see blood flow. Check for your staple line, sort of different things that you can't do with the naked eye.
Oh,
And it's just super smart. Like it'll take little minor tremors out, that
yeah.
all surgeons have, which makes it more precise. The stapler, and in bariatric surgery, the stapling is everything as far as like safety goes. It just does, thousands of little calculations as it squeezes and unsqueezes the tissue to get those staples like super, super perfect. There's just a lot of upside to it. And then on top of that, I'm a little selfish. It's difficult. Like I'm not old, but I'm not young. Standing for many, many, many hours on a hard surface can be hard on your feet.
Hmm.
Leaning over a larger patient, all day can be hard on your back. It can be hard on your shoulders. And then by the end of the day, like, oh, I've got some fatigue going on here. You don't want fatigue in your muscles, in your joints when you're operating. You can put your ports in, you can sit down, you're perfectly comfortable, just like I am now. You're working all day long, fresh as a daisy at the end of the day. It's just it's just nice. Yeah, it's just super
Yes.
nice.
Wow. I mean, I appreciate you taking the time to explain that, right? Because not most people don't know what the difference is, and it's cool to hear it from your own professional perspective about why you love that. And I
Mhm.
think it's also important just for the general population, the person who's maybe thinking about onboarding surgery knows this because it's showing them that the technology and the treatments for obesity are advancing, and the people who are in the obesity medicine space are advancing with what is coming, if that makes sense, right?
Yeah.
And I feel like robotic surgery is an area where they're making huge advancements. They're also making huge advancements in laparoscopic surgery. So, like from our patient perspective, it's like if you are a bariatric surgeon, if you're working with an obesity medicine specialist, man, they are at the top of their field, and many of them are staying up with all of the new ways to help people, and that's what's paramount.
Yeah.
Awesome. Awesome. Okay. Well, thank you for that.
Yeah.
We got some questions that we are ready to dive into, and you're going to see
Okay.
me kind of look in a few different directions. So I'm going to read the questions verbatim, and they most of these have come in from like our Bear Nation community members, or right people who follow you or who are your patients. So I'm going
Mhm.
to read their question verbatim, and then I'm going to just give a quicker like, okay, so here's the heart of the question, and then right answer it however you see fit. So if you're ready, I say that we just jump in and do this.
Okay.
Okay. Question one. It's about GLP-1. So directly from our friend. If you have tapered up to a 10 milligram dose because that's the best dosage for your head hunger and food noise, but are continuing to lose weight and don't want to anymore, would you suggest staying at 10 milligrams or try to taper back again and see if the lower dose can hold to the controlled head hunger, food noise? This person said, I tried that a couple of weeks ago, but my appetite increased right away and all my food thoughts were back. Okay, so that's kind of the backstory to her question. So the pared down version, I know, is so I tapered up to control food noise, but I keep losing weight I don't want to lose. Hold at that dose or taper down and risk the noise coming back.
So they're working, but working too well
On the weight loss side, right?
on the
We don't have
weight
any of
loss
the
side.
metabolic indicators, but in terms of what this person is experiencing, yeah.
Yeah, I would try and taper back. And there's actually a couple different ways to do that. Because you can either cut back on the dose that you're taking weekly, or if you're on the 10 milligram dose, you can try spreading that dose out. You can take it every other week, even every 3 weeks. And see if that works better for you. There's a definitely a few different ways to do it, and just kinda get with your provider and start going through some of those processes, and I think you're gonna be great. I mean, if I were picking, it's working a little bit too well for you or it's not working for you. I mean, it's a good position to be in. It's working a little bit too well.
Yes. Yeah. And I think so many people who are taking these medications, they think it's going to go one way and then it goes a different way. But then they're
Yeah.
afraid to ask these questions to the providers because they don't want to like feel like they're not doing it right, or they don't want to feel like they're, I don't know, right? You just have this anxiety around asking these questions.
Yeah.
But I think it is important to call out that sometimes how we think we're going to treat obesity and the treatments that we are on board don't respond in the way that we think that they're going to. And the key to all of this is having that relationship with your provider so you can ask these questions because this is a big one.
Exactly, and there's just so many ways to different play with it, and that's one of the great things about those medicines. Like, we prescribe them in a certain way, but you can actually deviate and change the regimen to kind of fit those individual patient needs. And you may just be a little bit of an extra responder, and so instead of once a week, it's once every two, and just kind of see
Oh,
how that goes for like a couple few weeks. And if that's not the thing that works, back down on the dose at once a week, and you can kind of play with it until you find something that's
yeah,
kinda perfect for you.
something that works. And that actually brings up another point that I wanted to make sure that we made in this. You, Dr. Joe, your clinic is really it's a holistic obesity treatment center. So not only are you a top bariatric surgeon, but you also treat obesity in so many other ways, right? It's medication, it's the pillars, it's nutrition, it's
Mhm,
movement, right? But you don't just offer surgery. And where we see this as important is that so if you're somebody's obesity specialist and they're having issues with the medication, let's say, you're prepared to talk about, okay, here's where we can go next. Here's all of your treatment options that could work for you. That is your job, right? As their doctor.
mhm. Yeah, and it's a great the way that the practice is set up is really, and I've done it this way for a long, long time. It really sort of like sets up the practice, and it sets up the patient for success, because we have a very strong kind of like surgical arm, and we have a very strong kind of like medical management and sort of like supportive arm. And, different patients are going to need different things along their journey. And so they can sort of swim back and forth, spend time over here in the medical arm, and, oh, I'm going to scooch to dietary. And now I'm coming back to you. And you can kind of swim back and forth as the patient needs, just to get them the best results.
Yeah, agreed. And the other thing, the other huge benefit that I see to this is a lot of times as patients, we can feel like our care is fractured, right? So we're going to this doctor for this RNP for this person for this, right?
Yeah.
And things can kind of get lost in translation, but I know a patients of yours because I know what my husband's stepping into, right? You're there, everybody's on the same page, everybody sees the same notes, everybody's talking about the same people. So if something does arise, the whole team knows about it, and you're really taking this like team approach to care instead of this siloed or fragmented care.
Hmm. It just makes
I,
it very facile. Someone who
I,
comes in for medical weight management, it's very easy in the same appointment. Oh, they might, I don't know, they've been thinking about a procedure. Can you
right?
step in there? And
Yes.
or the other way.
Yep.
Oh, I'm scared of surgery. I want to do medical management for a few months. Let's see where this goes. Yeah, we can totally do that. We'll start that, and I will see you in a few months, and we'll make further decisions. Yeah, it just makes it really easy.
Yep, it makes it really easy. It's actually one of the questions that we're going to get to today. So I appreciate you kind of setting the stage for that one because we feel that integrated holistic care is absolutely the way to go, and there's so many providers out there now that offer that. We're always encouraging or hopefully inspiring people to seek out that holistic care and teaching them how to do so. So we actually have a guide for this. If you guys would like the guide, just send us an email or comment on wherever you're watching this video, and we'll get it sent to you. But it's how to find a holistic obesity provider because that is important. All right. Next question from one of our great community members. This person says, let's talk about osteoporosis. I was just diagnosed via my first baseline DEXA scan. A suspected cause is malabsorption from my RNY. First, should we have a baseline DEXA before surgery? And if not, when? And what do ideal labs look like for maintaining bone density? And what supplements are important? I have a referral to an endocrinologist. What questions should I ask? So this is kind of a big one. Maybe let's break them down in those first three ones. Do you recommend a DEXA scan before surgery? And if so, when? And can you speak to the malabsorptive issues that can happen with some bariatric surgeries?
Okay. So I wouldn't recommend a routine DEXA scan for all patients prior to their operation. We would recommend a DEXA scan, and it's usually the gynecologist, more in the gynecology world, but would recommend a DEXA scan pretty much the same indications as everyone else. So,
Okay.
a lady over 65, a gentleman over 70, someone who is high risk, like they've had a fracture in the past, they have a strong family history, there are different medications, like steroids and things like that, that can put people at risk for osteoporosis. So if you're someone who sort of already meets the criteria for a DEXA scan and you're getting a gastric bypass, I think it makes it even more important that you get it. But I don't think everybody walking into a bariatric procedure needs a DEXA scan preoperatively.
Okay.
As far as bariatric procedures do put people at risk for osteopenia and osteoporosis, more so than the general population. And a lot of that is based on procedure. So, the sort of stepwise, a sleeve would be less risk than a gastric bypass, which would be less risk than a SADS operation, which would be less risk than a full double anastomosis duodenal switch. And so, your gynecologist or your primary care, can take all of that into, account as far as your risk goes, whether to get a Dex on you or not. I
Okay.
wouldn't get one routinely on everybody.
Okay. So what I did after my procedure is I did have a DEXA scan, and I was glad I did because in the back of my brain that was rattling around, and I know osteoporosis tends to kind of be something that the women in my family experience.
Mm.
And when I had my DEXA scan done, I came back with great bone density. So that was like a peace of mind for me. And I guess I just wonder, knowing the type of person that I am, I would probably have a DEXA scan done before my surgery if they could do it, because sometimes size is a limitation to having that done. So not every body can fit on a DEXA scan.
Mhm.
I mean, I guess I didn't need the data because I had the data afterwards. But if somebody is curious and if that's something they want to do on their own, just for their own peace of mind, is that okay to do? Is there a risk of having that data before you go in for a surgery?
Oh, I don't think there's any risk to having the data
Yeah.
beforehand. And like you, it makes sense with the family history,
Yeah.
to get
Yep.
one relatively postoperatively. But because we know as bariatric patients and as bariatric providers,
Mhm.
there is an
Mhm.
increased risk. It just makes
Mhm.
all of those really good habits, just following those basics, taking the vitamins, getting them checked yearly, know your vitamin D level, take your calcium if you're a lady, the strength resistance training to increase bone density. It just makes all of those things that we do to prevent those troubles in the future even more important because now we're on our bariatric journey.
And I really appreciate you saying that, because what instantly popped into my head is, as somebody that's undergone, right, treatment, I went into surgery thinking this is all I'm going to need to be healthy for the rest of my life, right? And then as these other health things have started to crop up, I find myself saying, well, this shouldn't have been an issue because you did all this work, to treat the disease of obesity. It's related to all these other things. But I know that this is not accurate thinking. I know that the treatment for obesity helps with so many metabolic issues, but age and genetics are still something that you are going to be battling, right?
Mhm,
So I think going into this, being hopeful that it's going to help with things in the future, absolutely. But we still have to live in the reality that we live in an aging human body. And the only way that we're going to know what we need is by having those labs and those tests done.
mhm, for sure.
Right, which is again why follow-up care and a holistic care team is so important.
Exactly, exactly.
Okay, okay.
It it's such a big hammer to help so many issues, but it doesn't
S
fix everything, because there's just a
Yes.
lot of genetics and metabolism in a lot of these other diseases, so
Oh my
it's
gosh,
it's
yeah.
it's a huge thing you could do, but it doesn't do everything.
It doesn't do anything. Nope. Well, and this second question, ironically, is also about a DEXA scan, right, and osteopenia. But the question at the end is really what I want us to focus on. So this person says, I'm 63-year-old postmenopausal female who is taking calcium citrate plus D religiously. I was recently diagnosed with osteopenia after my DEXA scan.
Mhm.
I've read that I should have it treated since I'm at higher risk for osteoporosis following RNY surgery. I was told that they don't treat it until it's classified as osteoporosis, which is extremely frustrating. She goes on to say, I haven't seen my bariatric surgeon since the day I was released from the hospital 3 years ago. The NP is the only one I can see. She is nice, but they do not have a dietitian or any other resources. So I'm working with my PCP to get all my labs, but I know I should find a new bariatric group. So the question here, right? So similar, but I think what she really wants to know is, right, I haven't seen my actual surgeon in years, just an NP with no dietitian on staff. Do I push my current team or do I find a new bariatric care team?
Um, so I guess in 2 parts of the question. I think for somebody with osteopenia, but not osteoporosis, but has a gastric bypass, and it sounds like you're doing the right stuff with your vitamin D and your calcium, and you're getting your labs checked with your primary care and things like that. I don't think that there's a different, recommendation to get into the treatment either with the oral or the IV, the bisphosphonate
Hmm.
um, than there would be in the general population who didn't have a gastric bypass. So I don't think that it's required that you have that treatment, at least as far as the recommendations go. Um, you know, it, every practice is going to be different. I mean, we have a lot of different parts to our practice to take care of the patients in a more holistic approach. But honestly, it's very difficult to do. You know, it's very costly. There's a lot of overhead to that.
You
You
know,
know,
business
um,
stuff.
some practices are just smaller, and honestly, that's okay. If you have if you have a team of, your bariatric surgeon and their team, in one office, in your primary care in an office, and, you have a good dietitian that you like, I think that it's okay that it's not all under the same roof. Um, if you think that, you're having a good journey and you're being successful. I mean, that said, if you're unhappy for any reason with your team, I think it's perfectly okay to, look for second opinions. And that goes for anything in medicine.
Yeah.
Whether you're having some gallbladder pain and a surgeon tells you to take it out and you're like, well, I really want someone, a second opinion. I mean, I'm always in favor of second opinions. So, if you wanted to find a new team, I think it's perfectly reasonable. But if you're getting great care, you know, and it's working for you, I think it's okay to stay.
I really, I think I've said this 3 times now. Again, I really appreciate you saying that because what I heard from you is you can be getting really great care from your team, and they're just not built or they don't have the capacity to do these other things that are tangential. And it's not a knock against them. They're doing the best that they can do. They're just not built for that.
Yeah.
So so it's this question of, do you want to continue with this team? Do you feel connected with them? Do you feel like they have met most of your needs? And now are you just looking to onboard, right, this additional level of care for osteopenia, osteoporosis? Or like what you said, are they just not a good fit? I mean, the best way that I can describe this, and I think everybody watching and listening this knows, sometimes you have that favorite pair of jeans, right? And they've been your favorite pair of jeans for a long time. And then one day you put them on and you're like, what? These don't feel the same. These don't fit great. Like things have
Mm.
changed. Yeah, things have changed, right? So are your jeans going to go back to fitting the way that they once were? Or do you need to maybe think about finding a new favorite pair of jeans? Both options are okay. And when we do this with clothes, we can also do this with our care team. It's okay to look for another. It's okay to acknowledge they're great, not built for that. I'm going to keep them and go on to do this, or find a new holistic care team. All those are options.
I agree.
Perfect. Well, there you go. That was a big question, and a lot of the questions recently that we've been getting are absolutely about, it's the GLP-1, it's the post-op bariatric life, it's the malabsorption, it's that kind of stuff. And we really appreciate you being able to answer these questions for us because they're top of mind for people and people want to know.
Yeah. And I think they're really great questions because, as this sort of space matures over this years that this space has been a space,
Hmm.
people are really learning that there's a lot out there to take care of them. And they're just kind of like expecting more.
Yep.
You
Yes.
know? And just the
Mhm.
questions have just gotten more complicated from, "I'm constipated post-op," like way back
Yeah.
when, like, everyone had constipation and had those questions and, that
Uh-huh.
sort of thing, like, just these, like, very complex, thoughtful questions, that people
Oh
have
yeah.
in the space now.
Yep. Well, and I have to give all of us credit there that are in this space because we have created the spaces where people do feel comfortable asking the questions that maybe they didn't have the bravery to ask before. Now they're
Mhm.
empowered, right? There's more information out there. There are more people like you that are willing to come on, right, these platforms and answer questions and help. And I think that just drives more education, which means higher engagement, which means you're going to have more people that will not only choose to treat the disease of obesity, but will continue to treat it as it progresses. So
Mhm.
that's awesome. Okay, last 2 questions. And I know I only got 30 minutes with you, so I
Okay.
appreciate a few
We're all
more
good.
minutes of your time. So, one of the questions that came in was about bariatric vitamins specifically. And I want to make sure I get it right. So, out of all the bariatric vitamins, which ones actually matter most? And maybe the question there is what makes bariatric vitamins different and why are they so important?
Okay. So, I mean, it kind of goes back to what we've sort of been talking about because, someone with a bariatric procedure, whether it's a sleeve or one of the malabsorptive operations, is going to be getting less vitamins, either from they're not able to eat as much food or they're paying a lot of attention to protein, which doesn't have
Hmm.
some of these vitamins in it, rather than, big salads and fruits and sort of things like that that are going to be difficult because we teach our patients protein, protein first, protein, protein, protein first, that sort of thing. You're going to need to supplement, especially if you have one of the malabsorptive operations. That makes it even harder to get those vitamins in. Um, as far as I don't have a particular brand or anything like
Yeah.
that I sort of the brand that I think is great is a good bariatric multivitamin. And what makes it bariatric is, in general, it's going to be um, more easily absorbed, and it's going to have more of everything that bariatric patients need in it. Like, there's just going to
Hmm.
be more vitamins in the bariatric vitamin, to kind of overpower what we've done to bring the weight down.
Yep.
So that's what makes the vitamin bariatric. But I don't have a particular brand. I always tell people, the good kind of routine bariatric vitamin that works well with your tummy, you know? The one
Bingo.
that works with your best with your tummy. And it may work great for months and then it doesn't work, and then you gotta switch it up and try a different one. But I'm okay with the pills, with the liquids, with the gummies, with the
Yep.
Starburst kind, that sort of thing, with the chocolate chews. And as far as importance go, I would say, multivitamin would be number 1. If you're lady, calcium is going to be a big one. We've just chatted a lot about osteoporosis.
Mhm.
Um, Thiamine, I think, is important. At least having enough thiamine in your bariatric vitamin, especially in the malabsorptive operations. Your vitamin D, people like some extra B12. People like the skin, hair, nail. That can be useful. But the big important thing is to, a pre-op check of all of those vitamins, routine checks of all of those vitamins, and then you can kind of tailor the approach that you take to them.
Yep, I think that's perfect, right? You and I have also often talked about this. The bariatric vitamin that's best for you is the one that your tummy loves and the one that's on budget for you.
Yeah,
That's it,
also
right?
true.
And also
Yeah.
true, right? And if you are shifting to more of a whole food diet after bariatric surgery, that's great. That is wonderful for your system, and your body's going to thank you. But it doesn't mean that you stop supplementing with that vitamin. That bariatric vitamin is something you are committing to for the rest of your life. And I know that there has been a lot of discussion about the added cost of like vitamins for bariatric patients. And I just don't think that's true anymore. There are some major bariatric vitamin companies now that will offer an entire year, 365 days of vitamins for not a lot of money, less than $100, right? So if you factor
Yeah.
that out over a year, you're talking about $12 a month for a very high quality, right, tested multivitamin that's built for
Mhm.
bariatric patients. And I also know that a lot of those companies are extremely generous. And if you can't afford your vitamins, if you reach out to them, more than likely they're going to be able to help you with that, either with a discounted rate or with a vitamin, sample. So it's absolutely worth doing it because you just cannot afford to skip your vitamins. It's just non-negotiable.
Yeah. It's just one of those things in life, it's just money well spent.
Yes, it is money. Well, oh man, money well spent. Look at that.
Yep.
I kind of feel like bariatric surgery is also that. It's money well spent
Oh,
because
it totally is. Yeah, also,
also also
it's why we do it.
why we do it. Oh my gosh. All right, very very last question, my friends. Again, one of our wonderful members said, "I can't take Advil or Aleve after bypass. What actually works for arthritis pain? Do you have any recommendations that you can give for them?"
Okay, so with the gastric bypass, you are connecting a limb of the small intestine directly to the stomach. They're different animals. They're not exactly happy together. And so there's a risk of these things called marginal ulcers at that connection that can be trouble. They can hurt, they can have bleeding, they can cause other problems. They can stricture down and squeeze that anastomosis down. Um, Big risk factors for that. Nicotine is a huge one. So bypass patients, it's never nicotine. I'm off topic, but um,
It's important to know too.
but, but also all those NSAID medications. So for just like your routine aches and pains, Tylenol is going to be the best and the safest. What I tell my patients is every occasionally you stub your toe and you have a couple Advil, it's going to be okay.
Okay.
Where you get into trouble is when someone sees an orthopedist and they put them on a high dose of a very strong NSAID for a long period of time. That's when people usually are going to get into trouble.
Okay.
Um, as a bariatric patient, it's always good to, you know, to tell your providers and sometimes teach them, I have a gastric bypass. I can't take this medication, for long periods of time. And they're going to help you come up with kind of alternatives. Because there are alternatives. I mean, for joint pain, things like gabapentin can work really, really well. in a little low dose. Some of the antidepressants are used in pain control. There's lidoderm patches and other topical things that can be done. And kind of as a side question that wasn't asked, it's common that people have migraines.
Mm.
Weight and migraines do run together, so it's common, and people are like, "Oh, I love my Advil for my migraines." There's a whole list of these sort of like Don Ed said migraine specific medicines that are out there in the world to get back with your neurologist and get on one of those like suppressive migraine medicines or something like that. If Because I hear a lot Advil's the only thing that treats my headache. Well, there's other choices to just sort of make your headaches go away, or to treat them in that moment that aren't NSAIDs. So you just have to have like a more detailed conversation with your headache provider.
Awesome. Okay. Yeah, and again, like what we talked about earlier, carrying excess weight for a lot of years can do irreversible damage, right, to our joints. And arthritis and those aches and pains can just kind of be a part of life post-op. And again, it can be disappointing, right? Because you go into surgery and you are thinking, "Oh, I'm not going to have these aches and pains anymore." Well, you might, but there are plenty of things out there that you can do. And again, right, it sounds like the solution is, right, look for those non-ed said NSAID items that could possibly be available over the counter. And right, really have a succinct conversation with whoever you're working with in terms of like your arthritis care, and let them say, I absolutely cannot take these things. What else is out there for me that we can explore? Right, just a
Mhm.
very simple question to that person is probably going to be the best place to start.
For sure.
Well, look at that. We did it.
Boom.
Boom, boom.
We got it to work and we were relatively on time.
This is like the first time, and I think in the history of Berry Nation that we've actually accomplished those things. But this time is so valuable for us. We just love it. You are so wonderful. You're fun. You're not afraid to answer the questions, and this is just what people how people like to engage now. And I think it's just wonderful that we get to have some fun while we do it
Yeah,
too.
exactly. Just hanging with
Oh,
friends. That's all it is. Hanging with friends
that's
another day.
literally that is exactly what this is.
Yeah.
All right, my friends. Well, if you watch the live, thank you for joining us live. If you're catching the replay, thank you for catching the replay. If you have a question for Dr. Joe, and maybe I should say that his name is Dr. Joseph Cribbins, but he likes to go by Dr. Joe because every time we say that, he does this like, oh, God, just no. So, Dr. Joe is here to answer your questions. Just drop them in the comments, or you can send us an email to hello@berrynation.org. We will pass them over to Dr. Joe and he will get them answered for us. But oh, I didn't really plan on doing this, but Dr. Joe, is there one thing that you're hoping, I don't know, people do or know about treating the disease of obesity? Is there like an inspiring message that you want to make sure people know before we leave today?
I mean, just something very simple like help is out there. I mean, we've progressed in our care so far, um, but people still can be very afraid, you
Yeah.
know? I mean, there's just so whether it's medications or dietary help or surgery, no matter what it is. I think that, the percentage of people who are getting care for their weight issues compared to the percentage of people who have weight issues is still way too small, you
Mhm.
know? Like we've come a long way. We're here to help. It's okay to start that first conversation. That's the big thing I'd wanna say to people, I think.
Oh, thank you. Thank you for saying that. I think that the fear of not knowing, the fear of being judged, right, all swirls in people's minds. And we've been told our entire lives that, right, excess weight is our fault, right? Eat less, move more. Well, eat
Mhm.
less, move more only works when you have onboarded medical treatment for the disease of obesity, right? Then, yeah,
Yep.
what you eat, how you choose to move, what you think up here, extremely important. But all of those things are not going to work to their full effect until you onboard that treatment. And the cool thing about obesity treatment now, as you just said, there are so many options, but nobody else has to know. This is your decision that you're making for your health. to make that appointment to go talk with Joe or talk to somebody like Joe, who is warm, caring, compassionate. They are not going to shame and blame you. They are literally there to help. That's all I can say this with 100% conviction. 99% of this man's brain is focused on other people, helping other people. I know this. I've spent some time with him. These are the people that are excited to help you. If you are feeling stuck, if you're feeling alone, if you're feeling isolated, if you're feeling like nothing is ever going to work, go talk to Joe or go talk to somebody like Joe, because you are going to find hope and inspiration and real help on the other side of that conversation. Thank you, friend. You're
Thank
welcome.
you.
You're welcome. We're doing good things. All right, you guys. Thank you for joining us live. Thank you for submitting your questions. We'll see you soon in the nation. Bye, friends.
Hi, everybody. Bye-bye.